multi-generations living in the same household. And then the other biggie really was exposure. And specifically with exposure, I mean, you have the healthcare workers who are kind of number one in that category, but also essential workers. When you have your historically marginalized, your minority populations, and really just socioeconomic individuals who are on the lower end of that, they're the people that are making up the vast majority of those of that workforce as essential workers. They're the people that have to be at work. They're the people that can't remote work. So seeing a lot of numbers from a case perspective and challenges in that area. So our strategy has been from the start of this really aligned with the CDC COVID-19 response to health equity strategy, and in particular priority strategy number 2 under that, which is expanding programs and practices for testing, contact tracing, isolation, healthcare, and recovery from the unintended negative consequences of mitigation strategies to reach those populations that are increased risk. So, going into lockdowns, closing down particular sectors has had a pretty devastating impact on society, but in particular on those historically marginalized, those essential worker populations that present the challenges for us. We've partnered with community and faith-based organizations to really focus on 4 main areas: building capacity to reach those impacted populations, developing communication strategies with culturally responsive materials, developing strategies to increase resources, and then building capacity to support vaccine administration. Because one of the things that we're going to find, especially in the minority populations, is a pretty significant hesitancy as it relates to, government programs, but also vaccination programs from the historical perspective. So public trust in general, but especially in those areas, is going to be a big challenge for us, not just here locally, but across the country. And then lastly, some of the key actions that we've taken is outreach to those vulnerable populations, and sort of the key highlight under that is mobile testing, which we currently are not doing any longer, mainly because of the weather. We've centralized our testing that we're doing to supplement what Meritus is doing to the Hagerstown Housing Authority site on Lee Street. But throughout the spring and summer and early fall, we really focused on those geographically challenged areas, the outlying municipalities, and then again, those historically marginalized populations, such as the Jonathan Street area and the Hispanic population sort of centers that we have here in Washington County, to really take testing to them to better avail themselves to that opportunity. That testing was free. Obviously, it was neighborhood-based, and we did a pretty, for us and for the capacity that we had, pretty significant number of tests. Also, transportation, and really trying to link up and through the Community Action Council, education and awareness. We did door-to-door, educational and awareness services through the established networks that we have. Really focused on COVID prevention, giving out safety kits with masks and hand sanitizer and gloves and information. Information, as I mentioned, about isolation and quarantine, especially in multi-generational homes. And then not so much yet, but soon, some vaccination, door-to-door, sort of public trust and public awareness for individuals who may be hesitant at getting a vaccination when that becomes available. We also worked with the FQHC, Family Healthcare of Hagerstown, for referral to other services as they became apparent in dealing with individuals, linkage to other services that may be needed. And then the other biggie for us was contact tracing and making sure that we were being culturally sensitive and culturally appropriate in dealing with individuals who, especially from a bilingual perspective, who may be in need of services through our contact tracing efforts. So in a nutshell, that's where we are and what we've been doing from a health disparities perspective. I will turn it over to Maulik now, or entertain questions. I don't know how we are planning to do that.
Well, thank you very much, Earl. That was incredibly informative, an awful lot of really good data to mull over. I would ask if you have a question for Earl to write it in the chat, type it in the chat, and we'll circle back after Maulik has made his remarks. That would be great. Maulik, are you ready to go?
I am. Thank you, Tara. Thank you, of course, to leadership Washington County and Greater Hagerstown Committee and the Chamber for doing this. I appreciate it very much. And thank you to Earl. Again, I want to express my deep appreciation and work with him personally and professionally with the department and all our county leaders. I think it's a great partnership, and we're really appreciative of working together and fighting this pandemic. I also just want to say, just very briefly, on behalf of Meritus Health, I just want to thank everyone in the community. Your support has been incredible over these last several months, and we truly appreciate everything you're doing, from meals to notes to face shields to anything. So just want to say thank you very much for that. So I'll just give a little bit of the COVID-19 dashboard that we track on a weekly basis. We have about 10 measures that we look at, and I'll just verbally go through these very quickly. In the green area right now, it is in a good sense, is of course ventilator capacity. That was a major concern early on. We have been operating at below 20% of our ventilators being used. So we have tremendous capability or capacity if anything worse happens. On the bed side, we've also been fortunate, although we've been closer to our ICU triggers, but we've been able to manage the current census, which is over 60 COVID-19 patients in the hospital. And on the PPE side, we're in a much better place today than we were several months ago. Although what I would say is, we have a fragile national supply system. So although it may seem great to have 60 days in service of supplies, that could easily go down to 30 or 20 if the next shipment doesn't come. And so that's a challenge for us. That gets into lab testing, which we've been very blessed. I think in our county together, we've done over almost 70,000 COVID-19 tests throughout Meritus Health, including our Creighton Boulevard, as well as in our hospital and other spots, as Earl mentioned. But that is undergoing, again, major changes because of the limited availability of lab supplies. And that's a national issue. And so we're running through different alternatives and algorithms to try to prioritize. But that's now what used to be in the green for a while, back to a yellow, almost to a red, in terms of just the challenge of getting quick turnaround time until we get better supply situation. Obviously, what's in yellow is our COVID-19 admissions that we were hovering around 1 to 3 a day for months. And now we're well over 10 a day in terms of new admissions to the hospital for COVID-19. Again, our surge planning, we're able to add beds and build capacity. But our biggest challenge is staffing, as you've probably heard throughout the country, in terms of challenge of finding clinical staff to support this surge. And we are fortunate, again, to have a great staff, but it is getting thin, and appreciate everybody who's doing additional work as we find agency staffing and other ways to make that happen. And in terms of outbreaks, we do have some significant numbers in terms of the skilled nursing facilities in our community and other areas. So we continue to manage that. Again, we're on top of it, and blessed to be working with incredible people, but it is starting to stress the system significantly, and will do so for a matter of weeks, if not months, honestly, as we continue to address this. So to get into the disparities issue, Earl gave some great information. And, the one thing I would say is COVID-19, of course, is unique, but there's nothing unique about COVID-19 and disparities. Disparities have been prevalent for decades in healthcare, unfortunately. And COVID-19 is shining the light on these disparities even more than what other areas have. Earl talked a lot about the national numbers as well. And, when you look at it, so nationally, the mortality rate for COVID-19 for Black and African Americans is twice that of white. Hospitalizations for Blacks and African Americans compared to whites is 4.7 times more and 4.6 times more for Hispanic versus white. I mean, those are staggering ratios. And the number of cases that Earl talked about is over 2 times more for Black African American residents as well as Hispanics compared to whites. Earl mentioned some of the county numbers. Our numbers are fortunately lower, although we've hit over 500 COVID-19 admissions now. We're fortunately still lower than the nation in many respects. But we do have some disparities. We do have some differences. All minorities, so again, including Hispanic, African American, Asian, Native American, are hospitalized twice as much as whites in terms of this. In our hospital, again, with small numbers, so I would caution this, but all minorities have a slightly higher length of stay for COVID-19. For those who've come on ventilators, which fortunately, again, has been very few, they've had a higher length of stay. So again, we have to understand some of these things. I think Earl said it really well. I mean, we know there are things that are causing these disparities, crowded situations, enclosed spaces, close physical contact, years though of the systemic inequities that we've had in healthcare is really the fundamental issue. Although there's so many important social determinants of health that I look around the Zoom, so many of you are addressing, whether that's healthy foods, whether that's transportation, whether that's housing, whether that's the environment in the home, whether that's wealth and income so that you can buy healthy foods and do other things. Those are really significant. And again, no different in our community, in our state, in our country, and whether it's COVID or asthma or diabetes or numerous other diseases. So I think, again, COVID-19 is really making even more brighter the flashlight around disparities in healthcare. We have them. There are a number of causes that relate to, again, social determinants of health. And what we need to do, I think we are trying to address, and, again, together we can address even better, but trying to address these social determinants of health so everyone does have shelter and housing and anything that they need that would exacerbate COVID-19 is important. That if you need access to care, to food, to transportation, that you're able to get that, otherwise that could exacerbate COVID-19. And of course, we've talked in many circles about unconscious bias training and other things, but those are some other things to think about. Again, an underlying issue that has nothing to do with COVID specifically, but gets to these disparities in healthcare. So I'll stop there so we can have more time for questions. But I really, again, want to thank Earl and the team. There are disparities. I think in Washington County, we've got so far fewer than others. But again, these are issues that are systemic in terms of the social determinants of health and how we address them as a community, which we can do, we are doing, and can only be done through a community approach. Turn it back to you, Tara.
Thank you very much, Maulik. I appreciate that. We do have some questions queued up. So as a reminder to anyone who joined a little late, add your questions in the chat and we'll pose them to our speakers. First question comes from Stacy Michaels. She asks, she's asking this question specifically of Earl. How are you addressing and handling the backlash of false negative and positive tests and the effect that it has on the community's confidence in the system as we go through these trying times?
So I would say that Dr. Joshi may be better qualified to answer than I, but I would say that is a challenge. I do know that Meritus and the testing that we are doing actually use PCR tests, so you don't run into it as much as, say if you're doing rapid testing and those sorts of things. So to be honest with you, I'm not aware of any significant issues that we've had with that. Certainly that has come up in some situations, but it's been mainly with individuals doing rapid testing. But for the most part, the whole, in public health, they're calling it sort of the infodemic. This whole, misinformation sort of pandemic in and of itself has been a tremendous challenge on top of everything that we've been responding to. And it's a really good question, because this is one of the things that we've been dealing with, sort of interwoven with the whole response. But we use the PCR test predominantly here. I would turn it over to Dr. Joshi. They do the predominant number of testing. He may have more insight into that than I.
Yeah, thank you, Earl. It's a good question. So the reality is, not every test, not any test is 100% effective. I mean, that's diagnostic tests in healthcare are just that way. So we struggle because we want to be so precise with COVID-19, obviously, but there are false positives and there are all false negatives, but we're at a high level of percentage. But, you know, even at 98%, you're going to have some. So I think that it's fair. And I think that it's, again, being highlighted because every single one matters in this. That's number one. Number two is, you know, clinically what they're seeing, we're learning along the way, is that you could be negative day 1 or 2 after exposure or so, but then positive 2 days later, and whether it's even PCR or the antigen test. So we are dealing with a disease that has that sort of longer incubation period and exposure algorithm that makes it a little challenging. So I certainly get the challenge in this. It doesn't feel good. It's a lot better, absolutely, than you might think it is, but it is a challenge. But again, we are talking about sensitivity and specificities in the 90s. It's pretty high. By the way, you know, flu shots, as most people know, are only effective about 70% of the time. So we're at a whole nother level, but it's COVID-19 and we want 100%.
Thank you both. You both presented some data points that were very, very interesting. Can you make those available to us or point us in the right direction to share them with our participants?
Sure.
That would be great. The next question to either of you is, what can we do to urge local municipal leaders to require safety measures and protocol?
I would say that, you know, anytime that you have an opportunity to connect with those individuals, you know, whether you have a personal story or whether you are a community leader over an agency, whatever, and the impact that may have on you and your staff, employees, they need to hear that, and they should hear that. So I would encourage you to reach out to them and share your concerns.
Agreed.
Very well said. I'm going to turn it over to Christina. She has a couple questions on her end.
Sure. So we're being asked, let's see, the first one was, what are the success metrics of your minority outreach, and what were your lessons learned, and what is needed to improve response?
Okay, so give me, my brain's in a fog. So what was the first question?
What are the success metrics for your minority outreach?
So really, I don't have that stuff in front of me, but really what we were looking for is to just have outreach into those communities and have those communities understand that at the time when we were reaching out, that mobile testing, you know, neighborhood-based testing was available in their community, and for anyone who desired to be tested, especially if they felt as though they were had been exposed, that testing is available literally around the corner from you or in close proximity. Excuse me. And then what was the other question?
It was, what were the lessons learned and what is needed to improve responses?
Well, the lessons learned, I would say one of the bigger lessons learned, and we obviously have never really dealt with a pandemic of this size, really, like in the past 100 years, has been, I mean, we've learned a lot of things along the way. And it really is, and this is what they say in emergency planning, you know, you always plan for the worst and hope for the best, but you also have these nice plans and binders. And what you find out is that whenever you need them, they provide a nice framework, but they have to be very dynamic and flexible in between. So one of the big lessons that we learned was in moving forward was really how to do testing and how to get those messages out into the communities, how to work with some of the sort of informal community leaders in those respective subsets of the community in those respective areas of the county. And really, how can we now translate that into vaccination planning? Especially with the hesitancy, not just amongst minority populations, but just in general. So how did we do it over here? How did we get people interested in testing? How did we avail them to testing? And how does that translate over into vaccination, specifically vaccination? Because that's our biggie on the horizon. And then there was another question, right?
There is, and I think this you both might be able to answer. Are you engaged in any steps to build an ongoing relationship and foster long-term health engagement with Black and Brown communities?
Well, yeah, we do that. And I think that to Dr. Joshi's point a few minutes ago, even pre-pandemic, the health department and Meritus and other community partners have really been trying to tackle those social determinants of health in those areas that are creating the disparities. So, obviously COVID-19 is, when we talk about, what we face from a health challenge standpoint has been the biggie in recent memory. But as far as reaching out and working with those communities, we've been doing it for many, many, many years. So working in concert with them and building on that was, and I'm not trying to minimize COVID, but here's another issue that we've got to work with you on. And as Dr. Joshi pointed out, COVID really exacerbates the harms that we're seeing from a lot of those other health issues, like especially diabetes and obesity. And, so it actually exacerbates what we're seeing with that. So I wouldn't necessarily say that we started from zero, but we basically just added COVID to the mix in dealing with those communities. Dr. Joshi, I know.
Yeah, Earl, you again, under your leadership and Alan Twigg and others, I mean, we have Healthy Washington County. We have a place in this county that other communities do not have, which is, bringing together stakeholders to focus on the health of the county. And of course, we've got the Lose 1 Million Pounds challenge and other things, but those are just examples of how we're trying to get us all focused around the issue, which requires us to have all the foundational elements working: relationships, working with minority communities, addressing social determinants of health, because you can't do anything else if we don't have that foundation laid. And so it's critical.
Thank you both. Next question. Based upon our numbers, aside from wearing the masks and washing our hands, what else can we do to stop the spread within Washington County specifically?
I would say unequivocally, we need to, early on we went into lockdowns and we had some pretty significant restrictions. And then we moved from sort of those government controlled administrative controls into really personal responsibility. And once we started to reopen through now, it's really come back to personal responsibility. Now, of course, we've kind of, through the state have ratcheted up and I guess you could say ratcheted down capacity limits and impose some restrictions. But people really need to, again, wear your mask, number one, wash your hands. But social distancing, I think, in addition to masking, doesn't get sort of like its due credit. Really, when you're looking at masking is great, don't get me wrong. Everyone should wear a mask. You should wear a mask anytime you're out, regardless of whether you're going to be within 6 feet of someone. You should just make a habit of doing it. But it also has to be done in conjunction with social distancing. Just because you have a mask on and you're standing 3 feet away from someone, or you're sitting right next to someone, you can still potentially be exposed. Masking is effective, but again, it's not foolproof. Depending on what kind of mask you have and the materials and those sorts of things. So masking has to be truly like hand in hand, like hand in glove with social distancing. And what we're seeing is, especially moving indoors, is 6 feet enough? I would argue that, I think a lot of scientists and epidemiologists would argue that it really isn't, especially in indoor environments, because you got to take into account ventilation and those sorts of things. So the big thing if I could say, in addition to masking, distancing, and washing your hands, is don't gather. Anything that you can do remotely, such as listen to the Earl and Maulik show, do it virtually. But seriously, any meetings that you can do, any gatherings, if they aren't critical, postpone them or cancel them or do them virtually. Because gatherings truly are the one thing that's just continuing to fuel the spread of the virus here locally.
I don't know if the Earl and Maulik show would even get a pilot, but I think the other thing, I mean, absolutely everything you said, and to me, it's what someone told me, it's always means always. I have to admit, I'm better at masking and distancing now than I was 4 months ago, just in the office and things. Anywhere else, absolutely. It really means always. It always, wear it, watch your distance, wash your hands. I've seen studies about people, they're a little bit more lax in washing their hands now than they were 7 months ago. So we really have to stay diligent in doing these things. They're the truth.
Oh.
I was muted. We have a question about seniors and then a couple people interested in talking about vaccines. As high risk, seniors can get very concerned when they are diagnosed positive. What would you tell someone over 70 or someone with other high risk conditions who finds out they are positive? What should they be doing?
Yeah, I would start with obviously make sure you talk to video call your providers and be in touch with him or her as much as possible. It's so critical. Obviously, isolate, quarantine, do the appropriate, but stay connected with people as much as you can virtually. I think that's critical for socialization as well as your clinical. Mike Lewis, I think I see him here talking about a story that we have another therapy available at Meritus, which I think is just another tool that we have to fight this pandemic. It's you probably read about this investigational medicine that is an infusion, and we are a regional infusion center, so we are able to take newly COVID-19 diagnosed patients with certain high-risk factors and come and get a 1 hour infusion with this antibody and then followed up with a 1 hour observation. So again, there's different treatments or ways. There is no cure, but we're trying everything in the toolkit to get that to go. And I think you'll read more about that shortly.
Thank you. Anything to add, Earl?
No, not on that. Dr. Joshi covered it pretty well.
Wonderful. So these two questions about vaccines are very, very similar. Both are recognizing that healthcare workers and first responders, essential employees will receive the vaccine first. But what are the plans to roll out to communities? Who's in charge of that rollout?
Well, that's a good question. So obviously the federal government's in charge of vaccine planning, distribution, and whatnot. As the pandemic has evolved very rapidly, vaccination planning and distribution planning is probably even more rapid than the pandemic. But what we do know at this point in time is that Pfizer is probably going to be first out of the gate. They've already applied for an emergency use authorization with the FDA. What you have sort of in a nutshell is a planning group from the CDC, which is working on prioritization, like who gets it first, those sorts of things. And then you have an advisory group, a committee that is independent but works with the FDA that sort of gives the thumbs up or thumbs down regarding Pfizer and Moderna and AstraZeneca, whatever the vaccine may be. So first and foremost, December the 8th through the 10th, that FDA independent committee is going to be meeting, and specifically they're going to be talking about Pfizer since they've applied for their EUA. Moderna is sort of going to probably be next out of the gate. Probably by the end of the week, they're going to at least report it. They're going to be applying for their EUA. But what they're going to do is really look at the efficacy of the vaccine, look at the data, and then obviously look at the safety. I do know that The feds are already pre-positioning Pfizer vaccines throughout the country. One of the issues with the Pfizer vaccine is that it has to be stored in ultra cold storage. I mean, literally like minus 80 degrees Celsius. We're talking like Antarctic conditions. And not very many people outside of major hospitals and academic institutions have the storage capacity for that. So I haven't heard from the state, but the thought is that those more sort of urban centers are probably going to be first on the list for receiving vaccine, and then sort of working out to the more suburban and rural areas. I do know that Moderna's vaccine is a lot more friendly as opposed to storage and distribution. It doesn't need to be stored at the ultra cold temperatures. It can be stored at regular freezer temperatures and those sorts of things. But again, it looks like Pfizer is going to be the first out. What you're going to see is that there have been no final decisions made yet. But the consensus from what I read is that healthcare personnel that are on the front lines, including support personnel that may be working in hospitals. I mean, you could be a person who, I mean, just because you're a doctor or a nurse doesn't necessarily mean that you won't necessarily be exposed. So even support personnel that work in those healthcare frontline positions will be included in sort of like the first wave, so to speak. It's going to be, there's going to be a pretty significant limit on the supply that initially comes out. So it's going to be kind of like your 1A, 1B, and 1C. But the 1A at this point in time, the consensus is, or the tentative consensus is, that it's those healthcare personnel and support staff, and then moving down to essential workers. The lists that I've seen are essential workers such as education, your public safety, first responders, agricultural businesses, food industries, those sorts of sectors in the community. So it all is sort of a moving target, but probably within the next week or two, it needs to come into see a greater light, because my understanding is that within 24 hours of approval, which could happen as soon as the 13th or 14th of December, distribution and administration is expected to start. I know the Maryland Health Department is preparing to receive vaccine on the 14th. Again, obviously all that's pending approval, but they've set a target date to be ready to go at the earliest December 14th.
Great, that is very good news, some hopefulness.
Now, I will say with that, just because we have a vaccine doesn't mean that we flip the light on and everything's over. Just the sheer limit on the number of initial doses, and really by the time that we get around to doing just general public, I mean, we're probably looking at next summer. So in addition to these limited vaccines that we're going to be seeing, masking, washing hands, and distancing are still going to be critical in this. And then there's just a ton of other questions. How long is that vaccination protection going to last? And even if I get vaccinated, is it really going to prevent me from being infected, or is it going to just prevent me from developing severe illness? And because a lot of these initial the initial data that's coming out is indicating that it's really focused on preventing an individual from developing severe illness or a more severe infection. And hey, if I'm infected, am I infected with a viral load enough to still transmit it to people that aren't unvaccinated? So there's still going to be a ton of questions, but don't get me wrong. There's certainly light at the end of the tunnel. It's certainly good news, but it's not the end all be all news. So I'm accused of being sort of doom and gloom whenever I meet with people. So it's good news that we have a vaccine, but don't throw your mask away.
We appreciate the truth. That's what we're after here. Sticking with the vaccine for just a second, we talked about the mistrust that exists within minority communities around medicine, medical professionals, vaccines in specific. How do we allay people's fears about getting a vaccine, getting a first vaccine, getting a vaccine at all? And I know some of these companies have one shot and then a follow-up shot. So that means people have to follow through. So that makes it even more challenging.
Yeah, I would say, I mean, it comes back to education, really. I mean, from my vantage point, we have to be as transparent as possible. And I think at the federal level, they're making attempts to do that. How successful that will be, especially with the sort of conspiracy theories and the misinformation that has sort of like been pervasive throughout the whole pandemic. But the feds are making it, the data will be available publicly. These two main federal groups, independent groups, but the groups that are working with the feds, they have open meetings. I mean, you can log on and zoom in the meeting, listen to the experts as they discuss the issues. But really, transparency has to be number one. Kind of like what you just said. I mean, you got to tell it like it is. You can't sugarcoat it. My 2 cents. Dr. Joshi may have thoughts on that.
Yeah, no, I think you're right, Earl. And on top of all that, what we have, I think, unique is a community leadership. And so you're going to get it if you trust and you believe the person who's telling you, you look at the information, you believe the education, but it's going to come down to the local leaders, relationships, and influence. And that's going to be so critical, like it is in any sort of mass campaign, right? You want to hear it from someone you trust. And that's why we need to do is get everybody kind of engaged in this, because it is going to be it's one thing to say it's available when it is fully available, but to get people across the line is a challenge. And we have to talk about why and why it's important to us individually and as a community.
Great, thank you. I have one more vaccine question, then we'll have 2 final questions. This is interesting. If you've already had COVID, will you be more likely to get the vaccine?
I don't know if you'd be more likely to get it. You should get it because, again, it goes back to how long do those antibodies last? Maybe you had COVID back in March, April. Probably by now, those antibodies, just in the evidence and the research that I've seen, if they aren't gone by that 6th, 7th month mark, they're probably waning, and you should get it. Even if you've had it in the recent past, you should get it. There's no evidence that says that there's a contraindication, to getting the vaccine if you've recently had the illness.
Great. This question may be more for you, Maulik. Obviously, the healthcare community, the people on the front lines in the hospital have been through a lot. There's some fatigue around that. How do we keep our healthcare professionals focused and energized as we go into this, whether you call it a second or third wave? We know it's going to be difficult.
Yeah, great question. As someone I know who just ran the 50-miler here, there's both the physical and the emotional part of this. And the physical is one thing because we've been at it and, taking off your gown and the gloves and everything, and then going into a room, coming back out, going back. I mean, that is a lot. So that's one. But the emotional is probably higher in today's world. So we try everything. And I thank everybody who's a part of it. We empathize with everything they're doing. We support in any way we can. And we recognize our heroes. And I wish I had a better answer. I keep researching this and talking to others because every single organization, even outside of healthcare, is facing this. Education, everybody, right? And anything we can do to support each other in so many ways. The little things go a long way. So, when you send letters, when you send notes, when you post something, it does mean a lot to people, especially on the front line. So I would say, please keep doing that. And we'll keep re-energizing people as much as possible. We've done little things. So in our hospital, we now have what we call oasis rooms. We took a little room and we put in a nice massage chair and nice music, and we let people go in there, recharge for 5 to 10 minutes. It's those micro breaks can make a big difference in your day. And it's hard for people to find the time when you're doing this, but we encourage people to do that. So we have one on every floor now. Again, a little thing, some people call it a compassion fatigue room or a rejuvenation room. I mean, they're just little ways to get people the little break they need to keep going. And unfortunately, there's going to be a lot of keep going. So we got to give as many breaks as possible.
Absolutely. So, it's important to us to offer some education around this topic, but as you can see on your screens, there's a lot of leaders in this community on this call, nonprofits, government, for-profit. What can all of us do to support the efforts to educate and get the information out more widely and making sure that we are reaching folks who are harder to reach in the outer areas of our county and in certain communities, practical things that we could actually do going forward.
So I would say, I know, specifically with the business community, I know the Chamber and Greater Hagerstown and various and assorted other business partners have been actively involved really throughout the whole process from the time that we started this in March, and have done a tremendous job at keeping sort of the response connected with the business community and really with the community at large. But I would say that anyone who would like to be involved, certainly reach out to us, because obviously there are, keeping the economy open and those sorts of things is a priority. But even outside of the economic environment, I mean, there are other sectors of the community that are experiencing just as many challenges. So anyone, just really reach out to myself, to Dr. Joshi, or to Tom Brown. He's actually the emergency manager for our Emergency Operations Center. And Dr. Joshi and I are the incident commanders. So really reach out to any of the three of us to connect with us. And, watch what you wish for, because we can give you a ton of stuff to do, but we would be more than happy to have, as many hands really sort of cradling the community and moving us forward as possible.
Just to think through a couple of things, it all comes back to leadership. And I think that's what our strength is as a community. So we're going to get through this because of our leaders coming together as a community in partnership. So I think I just can't underscore that enough. And because we're around shared goals, if we can say, hey, we want to get everybody vaccinated, or we want to do this, or we want to make sure no one has an issue in getting food on the table, that helps, or no one is in a space that makes it difficult for them to watch their distance, or no one has masks. I mean, if we can stick to those big things, then I know we'll mobilize to get us there. And I think that's a big deal. We have to pick those things and go after it together and stay focused on that. And then I would say, again, it's hard to have silver linings in a terrible thing like a pandemic. But one of many, I think, because we want to stay positive and keep going, is that this is shining light on disparities in healthcare. And again, whether it's pediatric asthma, kids going to the ED, different proportions based on your race, whether it's diabetes, whether it's maternal health outcomes, the differences are stark. And again, COVID-19 is shining light to say, we really need to work on these underlying systemic issues, which I know we are in this community, and we just have to stay focused on that.
Thank you. I'm going to sneak in one question because I think it might be yes or no. If somebody tested positive, they quarantined, all of their symptoms are gone, even if their employer or their doctor isn't requiring another test to ensure it's negative, should they get another test?
They should. You can test, especially with the PCR, you can test quote unquote positive for up to 3 months. Because really a PCR is picking up genetic material of the virus, and you go through your infectious period, it's still going to potentially be in your system for 3-4 months down the road. So they shouldn't get tested within 90 days of a previous positive test.
Got it. That's very helpful. We're going to conclude here, but I want to offer a comment. A management team member was hospitalized 2 weeks ago at Meritus and had only the highest praise for the care he received and the professionalism of the medical workers. So I wanted to share that with you, Maulik, so that people can rest easy about the care available in our community.
If I could add one thing onto that.
Sure.
And I've already spoken to Maulik about this several times, but since we're in a public forum, I would like to thank him and Meritus for, many things, but specifically for their ability to robustly test. The linchpin of this response has been our ability to test people and have the capacity to test, and to be able to turn those results around quickly and to get people into contact tracing and those sorts of things. And literally from day one, Meritus has stood up that capacity through thick and thin, and there's been some thin, but has really, maybe their knees buckled, but they've not dropped the ball. But they have done a tremendous job at testing and turning those test results around. And without those two things, you're handicapped in your response in a pandemic like this. So I just want to give, publicly kudos to Dr. Joshi and to Meritus for their ability to continue to be that linchpin in our response. The chain has stretched, but they have been sort of like the glue that keeps that chain from breaking. And I especially appreciate that. And I don't think the community appreciates the tremendous job that they are doing with that.
Earl, thank you. And again, the whole organization, everybody in the community has taken a part in this. I just want to say thank you to everybody. I would also just let you know, we are getting to more thin times because where we are nationally. So I just want everybody, it is challenging. But it is, this is highlighting also the importance of public health in everything we're doing. So more opportunity.
Really. Well, you can only imagine what Earl and Maulik's lives have been like this last year. So we really appreciate that they took time out for us to help educate us, to help us figure out ways that we can continue to shine a light on equity in our community. I'll invite all of you next Monday, same time, noon, where the topic will be about housing, housing insecurity, some of the issues with shutoffs in terms of utilities, another good conversation. So thank you, Earl. Thank you, Maulik. We really appreciate your expertise and your time. Thank you to everybody who took time to join this call today. Please join us again next Monday and also the following Monday. So continue the conversation, continue to think of ways that you can reach out in our community. I want to thank the Chamber. Thank you, Paul. Thank you, Greater Hagerstown. Thank you, Terrence and Jim. And Christina and I are really thrilled to be part of this effort. So thank you. Have a great afternoon.
Thank you. Thank you.